All right. Hello and welcome to everyone joining us today. I'm Kim Concepcion. I use she, her pronouns, and I'm the wellness coordinator for Department of Health. We offer a variety of different wellness programming, and one of which is bringing speakers in on topics that you're interested in and want to learn more about. And let's see, looks like we have an interpreter trying to get in. Oh, I'll turn on your camera in just a minute, Amanda. Thank you. Let's see if I can find you really quick. Okay, so a couple of housekeeping things. People are unmuted, or you're muted right now, and I just have you raise your hand when you'd like to ask a question, and we'll unmute you. And I will turn on the camera of the interpreter. So this will have ASL, and I need to grab the cart captions. I just remembered. Okay, take a breath for a moment.
We could all do one collective one together.
Let's do
Everyone's
all
like
one
rushing.
collective breath.
Yeah.
Yes.
You just drop our shoulders, and when I speak, I usually do 3 with the group. So if we want to take 2 more together.
Thank you, Francisco, for the cart captions. Thank you. So we are lucky to have Allison Immel back for session 2. If you missed session 1, it was, sorry, I should back up a minute and introduce Allison first. Allison Immel is a physician's assistant. Is that right? And functional nutrition professional. Currently practices in Olympia within the fields of urogynecology and pelvic reconstructive surgery and lifestyle medicine for women. She's currently engaged in educating physicians, associates, and other clinicians in these specialties, and furthering her mission to integrate foundational wellness principles into primary care and the conventional healthcare model. Allison, we have 3 sessions with Allison scheduled. Our session 1 focused on foundations and on the physiology of perimenopause and menopause and what happens with our bodies, a little bit on the nutrition, a little bit on the nervous system, and a little bit on HRT. And there is a recording out there. If you missed it, it is available both internally to DOH and externally on an external link for those of you joining outside of DOH. And this session is session 2 and focuses more on nutrition and stress, the nervous system, stress regulation, and how important those are to menopause and perimenopause. And I'll pause really quickly before we jump into the content. I'd just like to remind you that this session is open to everyone, both men and women, people inside DOH and outside of DOH. And so being really mindful about what you might share in the chat. And then you can put questions in the Q&A feature. And I'll keep an eye on that. I'll be moderating that. And then if possible, keep your questions to a kind of a more of a general sense. If it's a really individualized question, we may not get to it. All right, I'm going to turn it over to Allison.
Okay, thanks, Kim. Yeah, my name's Allison Immel. I've been practicing in Olympia for about 20 years as a nutritionist. Then I went to PA school, and then came back and did a functional medicine fellowship. And the whole time, my I guess priority mission has just really been to, like she said, integrate these foundational principles into the conventional model. And that includes, tending to the perimenopause, menopause transition from a foundational perspective. So I really do, we talked a little bit about the foundations last time, and we say it's clean nutrition, nervous system regulation, self-prioritization, detoxification, digestion, sleep, muscle building, and then community and connection. And these two things, nervous system regulation and nutrition and gut health, they are just paramount. They are foundational for every human being. This session is going to be a deep dive in how they connect to that perimenopausal transition and optimal hormone metabolism and hormone balancing. But I would love questions, because this is really a great conversation. And when I start saying things, people are like, oh yeah, that's me. Oh yeah. So if it is a general question or a general share or something, you can, pop the general share into the chat. And then, yeah, for sure, we can stop throughout to ask questions. So when I say nervous system regulation, I mean your stress. How are you handling stress? And then clean nutrition, more so than clean diet or lifestyle modification. We just want your food to be as simple and whole as possible so that your body recognizes it, knows what to do with it. Let's see. I'm not able to. There we go. Okay. Big ideas of today are that chronic stress makes menopause and perimenopause harder on you. Hypervigilance drains your hormones. We'll get into all these things. Healthy blood sugar balance promotes hormonal balance. Clean eating promotes a healthy microbiome, which promotes healthy hormone metabolism. Nervous system regulation and clean eating are basically essential for hormone harmony. And that's what we're after, right? We want things to stay in balance. We don't want any excesses. We talked about hormone therapy a little bit last time. We want to do as little hormone replacement therapy as we need to, or as few external treatments as we need to, but we use them when we need to. But we will never want to make sure, we always want to make sure we're not missing the foundations of things. So the foundations are the things that often get skipped in primary care. There's just not enough capacity, enough time, and not enough training to make sure that you're eating a personalized diet, or making sure that you're getting great sleep without a medication, or looking at your trauma and your stress and how you're responding to stress and how that's affecting everything. We get told, eat well, exercise, manage your stress, but it's really hard to do those things if you don't understand the root cause of it, and if you aren't given the tools to actually make that happen. So the origin of hormone imbalances, we see cortisol irregularities. Cortisol is that stress hormone. Bouncy blood sugar, we'll get into that. But when your blood sugar is just bouncing around all over the place due to high sugar diet or just skipping meals, you're going to see a lot of hormonal compensation. Adrenal fatigue, chronic hypervigilance, and chronic fight-flight, or fawn and freeze. So this is like everybody. We are all just like moving too fast, and we're ready. Like, we're ready for action, or we're not, or we're just shut down. It's either on or off. And what we want, especially in perimenopause, we want to learn how to kind of cruise in between. High glycemic diet, so a high sugar diet, a diet that spikes your blood sugar levels. Skipping meals, this is huge. So many people skip meals. So we really do promote eating regularly throughout the day. Poor sleep. We need at least 7 to 8 hours of good quality sleep to detoxify the brain, to help repair oxidative stress, to keep those hormones balanced. Caffeine and alcohol consumption, these are huge. Energy drinks, and no shame and no judgment for whatever's sitting on your desk right now at all, but the excess caffeine consumption, the energy drinks, artificial sweeteners, and then alcohol completely thwart any effort that you might be making to balance your hormones and to clean up your gut. I'm open to lots of questions around that, for sure. Stimulating medications, ultra-processed, that's just going to kind of whip your nervous system, and then can drain those adrenal glands. And then ultra-processed food diet, sedentary lifestyle, of course. If we're not moving, we're not using our cortisol, we're not using our glucose efficiently. And then suboptimal body composition. So if you have a high fat mass percentage and low muscle mass, you're going to see hormonal imbalances. So one of the reasons that women will experience such severity of symptoms in that perimenopause transition is due to the adrenal relay kind of failing. In perimenopause, the adrenals take over a portion of the hormone production as the ovarian function declines. So they hand that baton off. I think I mentioned this last time. They hand that baton off to the adrenal glands when they just slow down production. And that can happen during surgical menopause. That can happen with just a hysterectomy. That can happen when the ovaries just stop producing these hormones. But the problem is, your adrenal glands regulate your stress response. So they are producing DHEA and cortisol and epinephrine. And when you have that turned on all the time, they are like, you're hilarious, ovaries. We're not going to produce that estrogen. We're not going to produce that progesterone, that testosterone that you need. We're really focused on keeping this human being alive, keeping your blood pressure stable and your blood sugar stable. So when you live in a state of low resilience and hypervigilance, you are going to have more severe perimenopause and menopause symptoms. And so we'll talk about ways to kind of head that off. Supporting adrenal health through stress management, a balanced diet, and proper sleep is crucial during this time. So I love putting people on adrenal support way before perimenopause symptoms start to happen. People ask all the time, like, how long am I supposed to take this stuff? And I'm like, well, whenever the stress stops. So basically, the earlier you get started on adrenal support, the more regulated your nervous system will be and the more balanced your hormones will be. Specifically, the role of the adrenal glands in perimenopause is this hormone production. So they do produce the sex hormones, estrogen, progesterone, and DHEA. They also help convert the hormones, the precursor hormones from the fat tissue into estrogen and progesterone, and then they regulate the stress response. So this seems crazy, but it's one of my favorite tools to use in clinic. I want you to see how everything is affected or everything affects each other. So these are all your sex hormones. This is DHEA that converts over eventually into estrone, which is one of the forms of estrogen. This is testosterone. This is your progesterone, and then cortisol. So these are the ones I'm looking at a lot with my patients. Everything starts out as cholesterol. This is why nutrition is so important, especially in this time. You have to make and manufacture healthy cholesterol so that you can make healthy steroid hormones. Upstream, if you have any issues with liver gallbladder function, if fats go right through you, you don't have a gallbladder, you get burping after meals, you're probably not making awesome cholesterol. Cholesterol particles, the LDL particles, the first thing we see go up in perimenopause because the hormone levels start to drop. You get poor estrogen and glucose, poor estrogen production, poor cholesterol synthesis, and then it's a vicious cycle. Hormones go down, poor cholesterol synthesis, then you don't have the precursors to make your hormones. So cholesterol gets converted into pregnenolone, which is a big precursor hormone. Some people get pregnenolone replaced, and then it can theoretically convert into all these other hormones. But then this gets converted into progesterone, one of the first hormones to drop in perimenopause, and then that gets converted over to cortisol. DHEA we call your vitality hormone. It's an androgen hormone. And this ultimately gets converted, like I said, into estrogens and to testosterones. But you can see that if you have a high cortisol need, if you are just going 90 to nothing all the time, if you are skipping meals, if you're living on coffee and energy drinks and just saying yes to everybody and filling up your calendar and just buzzing all around, and you're worried and anxious all the time, you are requiring high cortisol production from your body. You're just demanding high cortisol. So you can see that if you've got a high cortisol production or a high need, you are pulling from your androstenedione and your DHEA. You're not going to get these hormones produced in a way that's going to support just healthy function in general. So remember, estrogen metabolizes your glucose. That's how you prevent insulin resistance and prediabetes. The testosterone promotes joy, motivation, focus, keeps your muscle mass on so that you can actually stay more metabolically flexible. When your cortisol is high, it steals from all of these things. I can't see any questions. Kim, are there any questions yet?
Yes, there are. So,
Okay.
one person has mentioned it would be helpful to discuss how we can get adrenal support.
You got it. Yeah, coming. Anything else that on the things that I've already talked about?
Nothing else so far.
Perfect. Okay. So how does this happen? I mean, modern society, that's the big thing. But really, it's this overworking, overproducing, this drive, this we call hustling for our worth. Just this internal drive to go beyond that internal governor that says slow down, rest, or say no. We just kind of feel up. And I'm not going to speak for everyone, but these are patterns that I recognize and I see. But we just tend to say yes sometimes when we maybe should just say, I can't take that on. Or we just we get into that hypercortisol production and then we're just in go mode, especially at work until 5 o'clock, 6 o'clock. And then we come home and kind of crash. So this overworking, overproducing definitely promotes that nervous system dysregulation, that high cortisol I just showed you. Major origin of this is trauma. So childhood trauma really does stay with you in the way that it lays down some patterns of functioning or over functioning. And so this can be from neglect, abuse, abandonment. Like a high ACEs score with a low resilience score can lead to nervous system dysregulation. So, I mean, we'll talk about some resources for that. Perfectionism. This is a big one with, I think, most humans. Perfectionism, and Brene Brown talks about this, that it's a way to kind of avoid your shame. And so really kind of hitting that stuff head on, anything that you have resistance to addressing it from an emotional standpoint can help to calm the nervous system. And this is so important because you can take supplements all day long, but if you actually don't get to the root of your nervous system dysregulation, you'll be on supplements and medications and extra hormones like for your whole life. There's a lot of freedom in actually understanding the source of your nervous system dysregulation and chronic stress. Low resilience to stress, inability to ask for and receive help. I see this a lot. Chronic illness, so any autoimmune illness or just a chronic illness in general, it just can put you in that fight flight state or that freeze fawn state. Stressful relationships, lack of emotional intimacy and connection, unprocessed or suppressed emotions like grief and anger. We see this a lot. People just feel kind of afraid to express grief or anger, and we store it in our bodies, and we just kind of stay in this like resistant or contracted holding position. And then lack of movement. And then I don't mean just exercise, but like literally just moving your body, a lot of rigidity. So the ways to nourish your nervous system, definitely manage your stress, meditation, yoga practice. I know that your wellness program focuses on a lot of this stuff. Breathing, movement, meditation, mindfulness, limit or avoid alcohol, smoking, and processed foods. Definitely prioritize sleep. Support your diet, which we'll get into. Certain supplements like ashwagandha and rhodiola can help. I'm going to give you really specific recommendations for that. And then doing that heart work, that grief work. So I really like the somatic therapy, the grief releasing workshops, EMDR, and internal family systems work if you really want to get to the bottom of it. So these are, for the person who was asking how to support those adrenals, these are the botanical supports that I use. L-theanine specifically, and remember, I am not making any direct medication recommendations or supplement recommendations, simply sharing with you the strategies I've used in clinic. Please, if you decide to do any of this stuff, consult with a practitioner who is versed in herbal and integrative therapies. L-theanine is amazing for helping promote the production of dopamine and serotonin in the brain. So if you're going to drink caffeine, drinking green tea with naturally occurring L-theanine is the best choice probably. So 200 milligrams of this, 1 to 2 caps per day, like in divided doses, really does promote serotonin and dopamine. So that's your well-being and joy. It can just kind of take the edge off. It can improve sleep and improve your HRV, heart rate variability, which is a resilience to stress. Ashwagandha helps to lower that cortisol production. So in that pathway I showed you, it can help prevent all of those precursors from going down that cortisol pathway. But not everybody can tolerate it. Rhodiola rosea is my favorite. It promotes focus and attention by creating more space. And so you know that feeling of overwhelm, like you just have so many people to tend to and things to do where everything just kind of feels like it's coming really close to you. The way I describe this to my patients is like rhodiola rosea kind of pushes it away. So you have some breathing room and you can actually see and organize. So it's great for that new onset or unmasked ADHD that happens in perimenopause. It's also great for just chronic fatigue, just kind of wearing out in the afternoons around 3 o'clock. And that can also promote good sleep. Holy basil is just something that calms the nervous system. This is an herb that you can buy just by itself. I do like trying these things by themselves, and then there are different blends that I like to recommend. Phosphatidylserine also prevents that cortisol production. On that steroidogenic pathway. And a lot of these are in a blend that I really like that I've put here below too for you to look at. GABA. So this is not gabapentin. GABA is the inhibitory neurotransmitter. So this is it calms you. So you can chew it. There's chewable tablets. You can take it in this tablet form, 750 milligrams twice a day. But it really does just quiet an active mind. Passion flower and then 5-flower essences can also calm the nervous system. So blood sugar handling and cortisol regulation go hand in hand. And this is where we transition into the nutrition piece. You want to make sure that your blood sugar is stable. And this doesn't mean you have to do finger sticks all day long. And it doesn't even mean that it's going to show up on your labs as like prediabetes. This is your blood sugar and your cortisol doing a dance with insulin all day long to try to keep you stable because you're chronically stressed and underfed. So when it bounces around, your insulin, your cortisol bounce around to compensate. So when blood sugar goes up from a high glycemic meal, so does insulin. Your insulin goes really high and then it's going to drop precipitously. When the blood sugar drops, then your cortisol is going to go up. So you may have had a meal like 2 hours ago, but your blood sugar's really low and now you're stressed and now you're wanting like something sweet or you're getting anxious. So this happens all the time, especially with like an energy drink for breakfast or like a muffin or something that's sweet, spikes your blood sugar. And then say you skip lunch and then you're exhausted by 3 o'clock. So this bouncing around is why we get one of the reasons we get hot flashes, especially with low estrogen, why we wake up between 1 and 4 a.m., why we get anxious a lot in the evenings, why we get tired around 3 p.m. And then just one of the reasons that you'll just start to see your testosterone, estrogen, and progesterone all start to drop in perimenopause. So it is so important to stabilize your blood glucose levels throughout the day by eating regularly, high protein. We'll get into that too. The stress hormone and the chronicity of stress, that's what we say, the chronicity of stress, completely interferes with the way that your body uses your food. And so if you're not managing your stress and you're not eating meals regularly or a low glycemic diet, again, your blood sugar and your hormones are just bouncing all over the place. So this is just a flow chart of how this happens. So you have chronic psychological stress, kind of living in that fight-flight state instead of living in the rest and digest state. This compromises what's called your HPA axis. That's the communication between the brain and the rest of the glands in the body. So your cortisol goes up. You have this stimulation of your autonomic nervous system. That's that fight-flight. And then you also have inflammation. So you're seeing an increase in fat storage, an increase in insulin resistance, and then you're also seeing inflammation inside the blood vessels. And now this chart points to type 2 diabetes, but type 2 diabetes is actually, it's just one of the chronic conditions that can manifest from all of this chronic psychological stress. And so it can be type 2 diabetes, more severe perimenopausal and menopausal symptoms. It can be autoimmune conditions. It's all rooted in this same pathway. And I can answer any questions. Oh yeah, there's a question.
Allison. Yep.
Yeah.
So there's a question, have the supplements been confirmed to survive the digestive system and deliver the intended compound into your bloodstream?
Oh yeah. Yeah. Like I said, I've been using these clinically for 20 years. I mean, it is what I've done with supplements, because there's a lot of criticism around supplement use. And you can find a study to support anything, but certain supplement products may not, like unlike a med, have not been certain, like you can't really afford, these companies can't really afford to test them. So what we rely on heavily is clinical experience when it comes to this, excuse me. So
Allison, what is an inositol supplement?
Inositol?
Yes.
Inositol improves insulin sensitivity. It's also, when you improve insulin sensitivity, so this is perfect, great question. Inositol improves insulin sensitivity. It helps get glucose into the cell really efficiently so that glucose and insulin aren't hanging out in the bloodstream, which can further inflammation. The higher your insulin is and the higher your cortisol levels are and the higher your blood sugar, the lower your DHEA, the lower your testosterone levels are going to be in perimenopause. Earlier, like in your 30s and your 20s and 30s and early 40s, it can actually raise your androgens, your DHEA, and your testosterone, and that's PCOS. So inositol is a wonderful supplement to help regulate that whole steroidogenic pathway by improving insulin sensitivity. Great question. I didn't put that on the slides. That's awesome. So to stabilize blood sugar, I didn't finish my question about, or my answer about the supplements. Clinically, those supplements absolutely work. I have people come in and say, that product completely changed my life. Oh my God, everything's so much better. Oh my God, my energy's better. Oh my gosh, my sleep is better. I mean, I have some outliers that things don't work for, but in as many years I've been doing this, I think I said this last time, the kind of supplements that I use or the specific products that I use have kind of sifted to the top. So I have my favorites that I know are safe, effective. I know the companies. I know the the sourcing is high quality, and that they work. They work. For these things specifically. So to stabilize blood sugar and cortisol levels, you got to eat regularly throughout the day. I mean, my patients get so sick of me saying this. You got to eat regularly throughout the day. So avoid skipping meals, and just remember that lunch is the most important meal of the day. Everybody thinks breakfast is, but if you think about it, lunch is when you're refueling from the morning and when you're fueling up for the rest of the day. So, and we all work. So sometimes we'll just grab like a cheese stick or a yogurt cup or whatever. You need to make sure you have a higher volume of food in the middle of the day to stabilize those blood glucose levels. So if you're one of those people who is waking up between 1 a.m. and 4 a.m., try eating a bigger lunch with higher protein content and see if that helps you with your nighttime waking and with your hot flashes. Protein stabilizes the blood sugar. So the goal, I put a wink face here because I don't get 30 grams 3 times a day, but the goal in perimenopause and menopause is 30 grams 3 times per day. A lot of people ask me, why do we need to eat so much protein? One of the main reasons that we have to eat so much protein, and plant-based protein does not cut it, and that's a whole nother conversation, is because we are actually pretty malnourished and our stress levels are so high. So we're not as efficient as we used to be. Think about when you're on vacation, sometimes you need to eat less, or when you have time off of work, you're snacking less. Our energy demands are so high with the level of chronic stress that we have and everything we're trying to accomplish, that the protein is the most efficient source without spiking your blood sugar levels. So we have more nutrition requirements to keep our brains going and to keep our nervous systems going, to basically stay hypervigilant, that the protein feeds that system without putting excess weight on, like I said, without spiking blood sugar levels. So it can be really hard if you're not used to eating this much protein. And sometimes people's digestive capacity isn't there either. Build muscle to improve glucose metabolism. So your muscle mass actually uses glucose without the whole insulin system. The more muscle you have, the more efficiently you use the glucose from your meal. So in our office, we'll often do 30 squats after we eat a meal. And then of course, going on a postprandial walk, walking after a meal, can help to put that glucose into the cell. But oftentimes if people are like, well, what can I do? If they can't change their diet, say, just start squatting, start putting some muscle mass on you. And then avoid those high glycemic foods like processed grain. Those things just spike your blood sugar levels. Again, we're trying to create more of a wave. Walking regularly, and then tend to a healthy circadian rhythm. Just really focus on creating healthy sleep routines. 2 things that I love really specifically is berberine. Berberine is an alkaloid that improves mitochondrial health. So this is going to improve fatty acid metabolism. That means you're getting that healthier cholesterol at the very top of that pathway. It improves glucose sensitivity. Muscle mass building, helps to burn fat. It helps to reverse mild fatty liver disease. It stabilizes your glucose, so then it stabilizes your cortisol, and it actually acts on one of those cortisol pathways that I showed you to prevent your body from just going to producing cortisol in response to stressful events. That's the goal. You want to receive a sort of pressured email and not have your nervous system completely flush and rush with catecholamines and chemicals that say this is danger. You want your body to be like, oh, that's an email. I got to get that done. The more times your body over responds to a stressful stimulus, the more spiking and dropping you're going to have. So berberine's amazing for this. And then Integrative Therapeutics, this is a very specific product, Cortisol Manager. And it has all that stuff that we mentioned, the phosphatidylserine, the passion flower, the L-theanine, the ashwagandha. It has all of that in there. And this is one I use a lot in clinical practice, especially with hot flashes, chronic stress, people whose blood pressure is up just a little bit. Like I said, I've been using this for a long time, and it works so well for most people. Again, there are some outliers for it overstimulates them. I think it's a reaction to the ashwagandha, but in general, this is an incredible product. I'm not recommending you go out and get this product. I'm just sharing with you that it's helped a lot of my patients. But you can try to take it before you go to bed, once a day, just before you go to sleep. You can also try it during the day. But if you've got if you're completely overwhelmed with your life, or if lifestyle change totally intimidates you, I recommend focusing on nervous system stuff first, and then trying, say something like the Whole30 diet. So clean nutrition, happy gut, harmonized hormones. Before we get going, do we have any questions, Kim?
Yes, we do. Thanks
Okay.
for pausing for a moment. So, what do you think about protein smoothies to increase protein?
So it's a great, easy way. We have to be mindful. There's certain ones that I like over others. So if you can tolerate dairy, whey protein is great. Some of the plant-based proteins are just they're harder on the gut. So if you don't have a lot of gas and bloating, you can do like a pea protein or a hemp protein. Um, the thing I like the best are the bone broth proteins. So I think a protein shake, if it's a high quality one, and when I say high quality, you can go through a supplement company, like a practitioner grade supplement company to get a cleaner protein smoothie or protein powder. I think the Orgain's okay. It's pretty clean. There are a lot of great clean protein powders online. As long as you're not relying on it for your sole protein source, if you're trying to get that extra protein in and it's like one meal a day, or a snack, I think that's great. As long as it doesn't, if it causes gas and bloating, it's not for you. If it has artificial sweeteners in it, it's not for you. If it's got tons of sugars in and high carbohydrates, not for you. You want to make sure it's a concentrated protein source. Good question.
All right, so the next one is should berberine be taken before with food, or does
Yeah,
it
so
matter?
you're asking about berberine. Yeah, so it's taken with meals. And so the research on this compares it actually to statin therapy for lowering cholesterol. In comparison for statin therapy, or to statin therapy, we say 500 milligrams 3 times per day with meals.
Great.
Mhm.
And then can you give, or maybe this is part of your presentation later, or can you give some examples of 30-gram protein meals?
Yeah, it's so hard. I mean, you could do like a steak, like a 4 to 6 ounce steak is like 21 to 26 grams of protein. And so you may have to add, I mean, you can add like an egg to that. One egg is only 6 grams of protein. It is hard to get it. I just want to say, I mean, you have these sort of influencers online who are just only eating meat, and it works for a while, but it's hard to sustain. So, like a 6 ounce chicken breast is anywhere between like 18 and 21 grams of protein. You can add like seeds to your salad. So, say you do chicken breast, half a cup of sweet potato, and then a handful of pumpkin seeds on your meal. You can get extra protein that way. Um, yeah, I mean, really, 6 ounces of an animal protein is going to get you the majority of the way there. And then adding things like the seeds, and maybe if you could tolerate dairy, you can add a little bit of like manchego cheese or pecorino cheese to the meal to get more protein in. We
So
good?
a
Oh,
follow up to that is if plant-based protein is not sufficient, how would a vegetarian get 90 grams a day?
it's really hard. It's really, really hard. So you can do if they are eating eggs also, um, that's really helpful. But certain cheeses, but again, you don't want to overload on dairy. Goat cheese is going to be a protein source. You can do the peas and the lentils and those kinds of things. You just have to be mindful of the carbohydrate level that's coming with it too. So it's not to say you can't sustain on a vegetarian diet. People have been sustaining on vegetarian diets for millennia. Um, if you have high chronic stress, you've got to pay attention to that too, so that you are decreasing sort of your need. But some cheeses, egg, lentil, sprouted grains and sprouted seeds and sprouted legumes are going to be more nutritious. They're going to have more protein in them. Hemp seeds, high hemp seeds, like a high amount of hemp seeds is actually a great source of plant-based protein for people. But I really like the hemp, the pumpkin seed. Um, I mean, those are my two favorite, and then sprouted legumes. It's
Lots
hard.
of questions. Been hearing about these beef organ gummies. Any thoughts?
I don't recommend gummies of any kind. I just if you need a gummy to get something in consistently, use it. But I don't like all the extra stuff that's added. You could just take the beef organ capsules. So yeah, organ capsules are hot right now, but they are nutrient dense. So you're not going to get exactly the protein that you need, but you're going to be getting a ton of minerals. That's what they're really pushing, is just this mineral content in the organ products. But yeah, I mean, the supplement itself, great idea. I don't love all the gummies, because then people start taking gummies for everything, and then you're like just eating sweeteners and gums, and that's not great for your gut. Ready?
Can we do one more?
Yeah, of course.
There's
This is
more,
this
and
is all you guys.
we'll pause on some. Um, is it safe to take berberine if you're taking a statin, or is it instead of a statin? Or what if you're on hormone blocking medications for cancer? Can you still take this, or
Yeah.
integrative cortisol manager?
Yeah, so these things, both of these things, again, you have to consult with whoever you're working with. I'm not making any recommendations for people specifically, but in my practice, I've been able to use berberine and a statin together for sure. The berberine is not it can replace a statin in certain individuals. In fact, it can be better than a statin for certain people, depending on where in the cholesterol synthesis pathway you're having a problem, but they can be taken together. Um, it should not interfere with hormone blocking drugs. It does stabilize your blood sugar. And so you have to be mindful of that. If you don't want your blood sugar dipping, you have to make sure you're eating enough food because it will start to ramp up your metabolism and your mitochondria. And then the cortisol manager, yeah, I mean that can be taken with most anything. The things I recommend, anything that I'm recommending generally is pretty safe. I mean, very safe, and can be used for most people. The things that require really looking into someone's med list and their history, I would not, really share that widely. Okay, ready?
Sure, go ahead.
Okay.
Thanks.
I know that there's so much stuff, and nutrition is hard because it's personal, and everybody's got their philosophies on it and their approaches to it. I'm open to everything. What I share about nutrition is what I see like protect people clinically, like what is actually reducing the inflammation in the labs and in their actual symptomatology. What is reducing their cardiovascular risk scores? What is improving their body composition? So I'm not going to die on any hills around nutrition. I care about really the patient right in front of me. And so but we're all very different, but we're also not all very different. So these are the things that work for most people. I just want to say that. I've been a vegan. I've done keto. I've done paleo. I've done, I've fasted. There's different seasons require different nutrition, I think. Okay. So, I mean, I can't see who all can raise their hand, but you can raise your hand if you've heard of the estrobolome. This is the collection of microorganisms in the GI tract that are involved in the metabolism of estrogen. And so your gut has to be happy if you're going to clear estrogen well out of your system. So it metabolizes estrogen. It helps to break it down and convert it into inactive metabolites that get out of the body. So bear with me. So when we are trying to clear estrogen out of the system, and this is so important, we are using these pathways, these liver pathways that are so dependent on the health of your gut to make happen. So these are all liver pathways, but they're dependent on healthy gut function um, to actually work. So the estrobolome, your microbiome in your gut, helps to clear the estrogen out of your system. So if you have a ton of gut problems, I see this all the time. If you have a lot of gas and bloating, you're going to have a tougher time on hormone replacement therapy initially because you can't clear it out. So those are the folks who are going to get like tender breasts right when they start, or they just can't tolerate it. And it's because it's getting stuck in one of these pathways. The estrobolome also reactivates your estrogen. So it can make it bioavailable for use in the body, which is great because you don't want to have to take a bunch of stuff that the liver has to then metabolize. The more efficient your system becomes, the less medication or supplements you need. And then it influences estrogen absorption. So it makes your receptors a little more sensitive. The healthier your gut is, the healthier your brain is, the healthier your hormones, the healthier, the more insulin sensitive you become. So how do we feed a healthy gut? You've got to have a diverse diet. So fiber-rich foods make short-chain fatty acids, which feed your good bacteria. You want to avoid all the ultra-processed foods. So I really do push a whole foods diet with most people. Again, I'm not going to die on any hills about what you're going to restrict, but I just want people to eat whole foods, not packaged foods. I want people to cook. And not everybody likes to cook, but you want to find somebody in your life who likes to cook and work out some sort of reciprocal situation. Include probiotic-rich foods, so kefir, kombucha, kraut, tempeh, yogurt, miso, kimchi, all those can help to feed the estrobolome. If fermented foods make your gut feel worse, then you have an overgrowth of bad bacteria in the gut, and that's something that we probably should address. And so that's usually an upper digestive issue where you're not digesting your food well. It gets into the small intestine, bacteria feed off of it, and then you get high methane and hydrogen gases, and then that's that painful and stinky gas and bloating that you might have. And that can contribute to a lot of bladder symptoms too. I always have to bring it back to the bladder. I am in urogynecology. Eat cruciferous vegetables. So cabbage, kale, broccoli, collards, broccoli sprouts, they all contain diindolylmethane. Diindolylmethane helps your body clear estrogen in phase 2 liver detoxification. There are certain supplements that also contain DIM, but it's so important. You can just get so much of this through your food. Some people take encapsulated broccoli sprouts. That's also great. Broccoli sprouts are pretty easy to make at home too. So if you're like, I want to do one thing, you could just start making broccoli sprouts and I mean, it works. It's kind of amazing. Other things that work really well, like to support healthy liver function, fresh grated beets, lemon juice in your water, dandelion root tea. These are all really simple things that you can do to just open up those liver pathways to start detoxing and metabolizing your hormones and everything much better. Avoid alcohol. You want to make sure you're drinking plenty of water. Exercise regularly. The recommendations are 150 minutes per week. It's hard to do that when we're so busy, but really getting out for those walks when you can, and then squats in your clinic space or your workspace or wherever you are with your work buddies. I mean, seriously, like 30 squats a couple times a day, that's great. That's great exercise. Avoid environmental estrogen disruptors. So things like BPA, all the plastics, parabens, pesticides, you get more of those plastics when you heat food in plastic containers. Those all have to go through the liver. And your liver function is essential for your gut function. You can eat all the right foods, but if you're eating an amount that's a little too high for your system, you're going to overload the liver. If you're exposed to environmental toxins, lots of parabens that's just exceeding the capacity of what your liver can actually clear, you're going to have a backup and not feel well. So when we say clean eating, it just means a lighter load on the system. That's it, without judgment. But these things, these pesticides, the BPA, they are going to be competing for space, for resources in the liver. So sometimes that estrogen gets deprioritized. Sometimes the sugar gets deprioritized to get these things out of your system. And sometimes they just stay there if your liver's really preoccupied. Targeted support for a healthy estrobolome is the DIM, like I mentioned, the diindolylmethane, calcium D-glucarate. Sometimes people need this when they've got a lot of bad gut bugs. Probiotics and then omega-3s that just decreases the inflammation in the gut. And then, of course, managing stress. Cortisol alters your gut flora and your estrogen balance, which you all know already. So the things that I really promote are, just generally, right? A low glycemic anti-inflammatory diet. So we want to make sure that you're not spiking your blood sugar levels and that you're not increasing inflammation. So concentrated proteins would be coming from fish, chicken, turkey, grass-fed beef, bison, venison, and some dairy. Oh, I forgot eggs on there. Oh no, eggs. And then carbohydrates are coming from starchy vegetables. So I really don't like to put the weight on grains and beans. They can be really difficult. I mean, everybody's got digestive issues these days. It's again, I've been practicing for like 20 years, and I used to be kind of a specialist in digestive health, and now I use my digestive training with almost every single patient, every single one, because so many people are having a tough time just digesting beans, fats. There are certain food groups that are harder for people to digest. So I don't want to emphasize whole grains and lentils and beans for your carbohydrate sources. I really like for you to focus on sweet potato, yellow potato, beets, carrots, the root vegetables. They tend to be a little lower glycemic unless you're sprouting your grains and your lentils. And we want to stick to like half a cup a couple times a day. So you don't want a whole plate of like sweet potatoes. You want to make sure that most of your plate is these vegetables, low glycemic leafy greens, all those cruciferous vegetables like the broccoli and the kale and the cauliflower. Half your plate's covered in vegetables a couple times a day, right? And then a quarter in that protein, that 4 to 6 ounces of concentrated protein, and then a half a cup of your carbohydrates. So half the plate vegetables, quarter of it with your concentrated protein, and a quarter of it with your carbohydrates, and making sure that you're getting those healthy fats like the olive oil, avocado oil, some avocado, nuts and seeds, butter and ghee. A note about avocado. If you love avocados, but you have any burping, belching, gas, bloating, constipation, diarrhea, look at how much avocado you're eating. An eighth to a quarter is the serving. If you're eating more than that, then you may be kind of clogging up your liver gallbladder pathways. It just does it. Too much avocado can cause liver gallbladder stuff. So we just want to, just goes back to what I said about, we can eat all these really nutritious foods, but if we eat them beyond the capacity that we have to metabolize them, they're going to cause gut problems. You have gut problems, you have gut inflammation, gas and bloating, you're not able to metabolize your hormones efficiently, then that's actually going to affect your stress pathway and your sense of joy. You make 90% of your serotonin in your gut. So if you've got gas and bloating and imbalance in good and bad bacteria, you're not going to be making those neurotransmitters that keep you happy and healthy. And that's when we reach for like energy drinks or stimulants, or we're overworked and overstressed, and then we're reaching for alcohol. So it's all a cycle. It's why I focus so hardcore on clean nutrition and then calming our nervous systems. I was going to say chilling out, but yeah, sometimes I use swear words too with my patients for emphasis, right? Okay, and then minimize sweets and no processed sugar. So I love food so much, so I'm not going to ever say to anyone, like, don't ever have sweets ever again in your whole life. Just be smart about it. Whole fruits are wonderful. You're getting all that fiber and all those phytochemicals. Coconut sugar is a wonderful way to sweeten things. It's not as high glycemic. Using raw honey and using some maple syrup, they're sweet, excuse me, but they're whole, excuse me, sorry. But they're whole and they're real. They're not heavily processed. So you just use them in small amounts. And think about these things as we're going into the holiday season too. Just load up on your protein, load up on your vegetables, but still enjoy all the little sweet treats along the way. If you've got enough protein and vegetables, your blood sugar is going to be cruising like this instead of spiking. And a lot of people will eat the sweets and then they'll be like, oh, I'm not going to eat anything. Oh, I overloaded. Like if you eat sweets, go eat some protein to stabilize you. Don't starve yourself. We don't do that anymore. It's not the 90s. We don't starve ourselves anymore. We nourish our bodies for sure. Better to have some extra fat on your body and a stable blood sugar than to be skinny and have your cortisol bouncing all over the place, because that really does affect your hormones. So these are the four diets I typically recommend that people adhere to. Paleo, it's low glycemic. It's kind of heavy on protein, but just lots of vegetables. We say a vegetable heavy paleo diet. Mediterranean is great for vegetarians. You're getting all those healthy fats. You're getting proteins from some cheese. Being smart about whole grains, lots of vegetables. Autoimmune paleo is an anti-inflammatory paleo diet. And then the Whole30. The Whole30 is awesome. It's so easy. I prescribe it all the time. Just make sure you don't overdo nuts and potatoes on the Whole30 and you should be good. But you can go to whole30.com. So some takeaways, and we can get to some other questions. Chronic stress significantly affects your hormonal balance. If your cortisol and your insulin are bouncing around all over the place, your perimenopause journey is going to be rough. Understand the root cause of your chronic stress helps you address it completely and holistically. So we don't just, supplements are great, medications are great, but they don't address the root cause. So really getting into that grief work, like really emptying out and getting to like what is eating you. That's going to be like the ultimate way to regulate your nervous system. And then supporting it with meditation and yoga and exercise. Then tending to the gut definitely improves overall hormonal health. You want to get that estrobolome optimized. And then obviously optimizing your nutrition improves the metabolism and the hormones. So we've got another 10 minutes for questions now.
Woo! Nice job. Take a breath.
Yeah, sorry to go so fast. I want to get it all in.
I know. There's lots of questions, and I think that you've answered a few of them, but so are the supplement recommendations evidence-based? And
Yes.
What are your thoughts of clean nutrition in relation to increased cases of disordered eating?
First of all, everything that I do is evidence-based. So I'm trained in the functional medicine model. And so everything that we recommend, everything that we share is all evidence-based. I don't know, we've got 30,000 studies or something on these things. So yes, I would not ever recommend anything that wasn't tried and true. And then it's with disordered eating. I mean, we focus on nervous system regulation and then just really, really meeting a person where they are. And so just picking one thing, especially with inflammation. So if we just say, okay, and if there are other symptoms that are associated with a certain thing. So I'll use urogynecology. Artificial sweeteners are a big bladder irritant. They cause a lot of leakage. And so it's really, I want to be really mindful when I say, you got to get rid of all soda. You say something like that to someone with disordered eating, and there's an immediate nervous system response. So I really do, I have a heart-led practice. So it's more important for me to build intimacy and connection with someone so that we can actually do the work than it is for them to like adhere to some rigid recommendation. And I think that more and more clinicians are becoming more versed in that and sort of like the just tending to people where they are. Um, but I would not recommend a restrictive diet to anyone with disordered eating. I would really focus on nervous system regulation first, and then just pick one or two things that we can do that are immediately or directly connected to the symptoms.
Great. Do you support any specific gut cleanses or recommendations?
So the simplest thing would be to do the anti-inflammatory diet, the Whole30. So it's an elimination diet. You go on it for 30 days, and then you slowly reintroduce food so you can identify your food triggers. The reason I recommend the Whole30 is because there are so many resources online for this. You can join Facebook groups. There are books. There's a Whole30 approved stamp that goes on certain foods in certain places. So that's a great place to start really simply. But as far as like a gut cleanse, I don't do that. What I do would be to order like a functional stool test to see what exactly is happening, or clinically try to identify small intestinal bacterial overgrowth or just leaky gut syndrome. It would be customized for the person. There are plenty of things people swear by, but again, I do a lot of personalized medicine. So the Whole30 is about as general as I get, and then we could use certain supplements or dietary adjustments to help people specifically address their inflammation or leaky gut or immune overreactivity in the gut. It's probably not the answer you're looking for, but as far as gut cleansing
See,
go, I mean, just decreasing inflammation in the gut and improving your digestive function from top down. I mean, that's going to take care of it. I recommend gut rest all the time, but um, that's a great place to start.
what is a good supplement to take for high cholesterol?
Berberine. So Berberine great. It really is. I mean, again, I'm not making recommendations, but just you can look it up, talk to your provider. There's a ton of research on it. I teach the PAs down at Pacific University, and a couple of years ago, I include Berberine in the I teach integrative and functional medicine to them, and so we go through case studies for cholesterol. And I had one gal say, she says, so basically Berberine fixes everything, and I was like, I mean, kinda, but I was of course kidding. She ended up doing her thesis on Berberine. It was pretty amazing. It works really well.
Great. What about is it Psyllium powder?
Yeah, psyllium.
Psyllium. Yeah, for gas and bloating.
So fiber's essential to create those healthy bugs. Sometimes people will add psyllium husk fiber, um, and it'll actually increase your gas and bloating. That's an upstream issue that you're just not able to break down that fiber, and then that's feeding. Anything that's under-digested is going to feed bad bugs in your gut. So if the psyllium husk fiber is great. I am a huge proponent of healthy bowel movements every single day. So oral magnesium can be really helpful, and then adding in the psyllium husk. I also recommend a lot of flaxseed meal for fiber, for gas and bloating. Psyllium is not necessarily a food. It's digestible, but it's not necessarily a food. Flaxseed meal is highly nutritious and also has less fiber. So do chia seeds. So making like chia pudding, my God, that's so good. That's easy.
Yes, someone mentioned they make a chia seed pudding.
Yeah, perfect. 3
Chia
tablespoons of chia
seed.
seeds, 1 can of coconut milk, a tablespoon of maple syrup, and a pinch of salt. Stir it up really, really well, and then leave it like in a mason jar and leave it in the fridge overnight. So 3 tablespoons of chia seed. That might be too much. That person who makes it, I never measure. I just eyeball it. I'll say 2 to 3 tablespoons of chia seeds, depending on how thick you want it. Can of coconut milk, pinch of salt, maybe a tablespoon or less of maple syrup. good stuff.
Awesome. Thank you for that recipe.
Mm-hmm.
How does someone find a colleague that you could recommend in north of Seattle?
You can go to the functional medicine, ifm.org, if you want to work with a functional medicine person, ifm.org. You can look up functional and integrative practitioners in that area. It depends on what you want. Do you want gut health stuff, or do you want hormone therapy? I mean, lots of functional medicine providers will do all of this because our modules that we do, we're doing hormone replacement therapy, we're doing mitochondrial support, we're doing cardiometabolic, we're doing gut health.
Do you have a source for fresh dandelion greens and roots? This person
Yeah,
loves them in salads and teas.
yes, perfect. So the Olympia Food Co-op actually always has red dandelion greens. So every week I make a pesto with it with cilantro, dandelion greens, and parsley and pumpkin seeds. So the co-op in Olympia has it. So a lot of grocery stores actually carry it now. And then traditional medicinals roasted dandelion root tea is easy and it's delicious. Double bag it if you like the bitter. It's really good to get used to bitter flavors. It's great for your liver and it's great for your gut. But yeah, I swear by roasted dandelion root tea.
Here's a question. Recently diagnosed with ITP, an autoimmune disease that's attacking my platelets. The prednisone has given me diabetes, and I've been able to start back on HRT finally after months of not being able to take it. Any suggestions for nutrition to help with my immune system better identifying friends and foes?
Yeah, so in general, so I'll just say like general for autoimmune, doing an elimination diet like the Whole30 can just help you get a baseline. Then you start adding those foods in slowly. Um, anyone with autoimmune would probably benefit from a functional stool test. And so that's what you have to go through a functional medicine provider. I'm not saying everybody needs functional medicine, but if you wanted to do the deeper digging, especially with an autoimmune condition, you would want to work with someone. So like Heart of Wellness here in Olympia, um, Trish Sylvester, um, I mean, you can just look up functional medicine provider and they can do a functional stool test for you. But yeah, the elimination diet. I mean, again, the Whole30, it's pretty foolproof. It's great. It's helped so many of my patients. I mean, hundreds.
Great. Here's a comment that this person loves that you say that your heart led and that she had wished she had you for her urinary needs, currently suffering from ongoing surgical complications from a July surgery, and the doctor was not heart led and was dismissive and did not address the complications properly.
Shoot, I'm so sorry about that.
Someone else has thoughts on DH. Do you have thoughts on DHEA supplementation?
Yeah, I mean, a lot of people will measure DHEA and it's low, then they replace it in women. And I really have found that, and this isn't for everybody, but women don't seem to do great with DHEA replacement. When we give women the herbs, like ginseng can actually really boost your DHEA naturally, and then managing your chronic stress, like addressing other points on that steroidogenic pathway can help boost your DHEA. It can lead to some like facial hair and a lot of irritability. And I think that has to do with the fact that the underlying cause of metabolism and nervous system dysregulation wasn't necessarily addressed. So, I mean, I tried earlier in my career, I tried it a lot because I was like, oh, low, replace it. And it just didn't really work that great for most people. But some women love it. Vaginal DHEA is great for our patients. So that's a different story, but that works really well, like a vaginal preparation, something like Julva, Julva. But if you're looking to replace it to actually be as a precursor to testosterone or estrogen, focus on the nervous system regulation, some of these botanical supports maybe first, like ginseng, and then you can add it in. But it's not unreasonable to try it. You just make sure that you're not doing the male doses of 25 to 50 milligrams. You want to do like a 5 or a 10.
We are out of time, everyone. So many great questions. I'm sorry that we are not able to get to everybody's questions. Allison, thank you so much for your time and all of this wonderful information. Folks, remember we'll have one more session with Allison. It's on January 8th from 12 to 1. And the link is out there within DOH, and I think it's external as well. To register for that, and we'll send that out along with updated with slides and a recording of this session and the first session to those that have registered. Thank you all for being here and all your wonderful questions and engagement. Have a great rest of your day. Go take some deep breaths.
Yeah.
Go get some movement.
Slow down. Slow down. Yeah. Thank you so
Thank you
much for having
again.
me. It's super fun.
You bet. Thanks again, everyone. Take care.